Well, I want us now to look at a story that has continued to cause a lot of worry and concern in the public tonight. An oxygen crisis in the country continues to bite, and patients are losing their lives while in search of this precious commodity. The demand for medical oxygen has seen COVID-19 patients, as well as others suffering from different ailments, compete for the little available supply. Tonight, we put a human face to this crisis that continues to threaten lives. Take a look. An oxygen cylinder and a number of pipes. This is the life 22-year-old Brilliant Wangoi has known for the past 12 months. A cesarean section operation gone wrong left her dependent on medical oxygen. She literally hangs on to this constant supply for dear life.
Date 25 nilijifungua through CS. Hapo ndo nilianza kuugua wakati mtu anapewa ile time ya kurecover after kujifungua. Nilikaa for 2 weeks bila kufanya kazi. Venye nilianza kufanya kazi nikarealize nikifanya kitu kidogo na nachoka na anza kuhema. Niko admitted already Masimisha. Akasema nikidischargewa nikuwe discharge na kama tumepata oxygen concentrator. Ati juu I need oxygen. Yani siwezi kaa, yani mapafu yangu hawezi pumua mwenyewe. Sasa nda discharge tu kama niko nayo kwa nyumba.
The presence of this oxygen cylinder smack in the middle of this one-room house that Brilliant shares with her grandmother and her 1-year-old son in Bondeni, Nakuru County, is not the biggest of her worries. The price of this precious commodity is.
Hiyo cylinder ya kwanza tulikuwa tuna refill na 1600, which ilikuwa kwa siku sijui tuna refill mara ngapi. Ilikuwa inaenda haraka. Mami kakaona inamshinda, imekuwa expensive. Saizi hata siwezi kuambia mama kuna deni kiasi gani hapa. Madia anaogopa kwenda kazini juu ana deni za watu. Alafu tena kwenye watu tunachukua oxygen tuko na deni.
The average cost of refilling an oxygen tank for home use is 1,300 shillings. However, a recent spike in demand has seen the prices double. For Brilliant, she needs 2,500 shillings daily to remain alive.
Imekuwa complicated. That hata mimi mwenyewe siwezi kuambia aswana atakuwa treated for what. Mimi ningependa tu mnisaidie. Valuations wanisaidie tu. Hizo kupata hizo vitu kama hiyo maziwa ya mtoto, mimi kupata chakula, dawa na oxygen. Sitaki hata pesa, nataka tu mtu anileteage ndio hiyo oxygen, ndio hiyo maziwa ya mtoto. Hivyo nita appreciate you at least life yangu, cause ukweli siwezi kwa promise nitarecover kama nina stress hizo vitu. Naonaga hii oxygen ikiwa imefika kwa zero, naanza kupanic. Juu ikiisha, nashinda tutatoa 2,500.
Only one person works in this household, her grandmother. She sells tea, which doesn't make her much to meet the constant bills.
Hii mtungi kila siku. Ikifika kama saa hii, wananipigia simu. Wananiambia mtungi imeisha. Naambia, ai, imeisha na sina pesa. Nikiwa tu hapo kazini nauzaga chai kichinjio. Naambia watu mimi sijui nitafanya nini. Mtungi imeisha na sina pesa. Wananiambia shika hii inatosha. Naenda nanunua. Siku moja nikaambia msichana wangu nikitoka kichinjio, mimi kesho hii mtungi kiisha sitakuwa hapa, mimi naenda. Mimi natoroka. Akaniambia utoroki mama.
It's a high price to pay for a commodity many breathe freely every day, yet remains ever so rare for those who need it the most. Thanks to the raging third wave of the coronavirus pandemic that has seen an acute shortage of medical oxygen countrywide, some have had to pay the ultimate price. Embu-based journalist Ruben Githinji was one such case. The 52-year-old's last dying days involved family and friends running around to secure him oxygen and an ICU bed to save his life. His wife, Purity Murage, remembers this all too vividly.
Nigonjeka on Saturday, tukashinda Saturday na Sunday. Sunday nikampeleka hospitali, county hospital, wakanituma referral general. Nikaenda general hospital, akawekwa oxygen na akakaa kwa oxygen for few days. Afterwards daktari akaniita akaniambia hakuna oxygen mzuri na anaendelea akiwezwa sababu oxygen ya general haifanyi. Sasa nikaambiwa nimtafute Nairobi hospitali, tukatafuta nyingi sana kwa government sikakosa kabisa. Tukaanza kutafuta private ikawa too expensive, but at long last tukapata Murang'a Hospital.
Ruben would later succumb to COVID-19. The crisis has left a trail of death in its wake, pain and more questions than answers in slightly more than a month. The third wave has seen a jump in the number of COVID-19 patients in need of oxygen. In March, for instance, the Ministry of Health reported that 68 patients were on oxygen. 40 days later, on April 11th, a total of 482 COVID patients were on oxygen, with the supply said to be limited.
We're having a problem with delivering oxygen to our patients, especially now with the resurgence, or should I say the so-called third wave of corona, which has put a lot of pressure on our oxygen supply. So the demand is really outstripping the supply.
Statistics from the Ministry of Health also indicate that before the pandemic, the average demand for medical-grade oxygen was 410 tons. But as of March 2021, the demand went up to 880 tons, up from 560 tons in January this year.
From the simple lack of oxygen delivering to them. I want you to put this into perspective, Kisa. Typically, again, pre-COVID, most of the patients that we were giving oxygen, the maximum, in most cases, was 15 liters per minute. We give it in liters per minute. Mostly it was somewhere between 2 to 6 liters per minute, but for isolated patients, you would go to 15. So maybe an average of 5 liters per minute. Right now, we have patients in our ICUs who require flows as high as 60 to 70 liters every minute. That is 12 times what we have been having. So the plants we've had have been producing oxygen just enough for us to give 5, maybe 10 liters a minute. Now we need 12 times that.
Hospitals across the country are already overstretched. Last week, Kenyatta National Hospital suspended planned surgeries indefinitely following an acute shortage of medical oxygen.
A typical level 4 or level 3 hospital could have probably just had 1 cylinder, maybe 0. With some luck, they would have 2. As you go up, then you get more and more cylinders in the hospitals. Right now, the demand has become so big that this is just impossible for them to supply.
Kericho's Siloam Hospital has also asked other facilities not to refer COVID-19 patients without adequate oxygen supply in the ambulance.
Hospitals who are referring people to other hospitals, make sure you have enough oxygen in that vehicle bearing that patient to another facility. It is no need to release a patient from a facility with one small cylinder of oxygen. You need to put in what you estimate is enough to reach that patient to the facility.
In 2020, the government set up an oxygen task force, which, according to the Ministry of Health, has since identified issues of service, maintenance and operations and piping as a requirement.
We are trying to play catch up. Yes, I agree with you. We should have probably, where we sit, we ask the question, how can we increase the supply and the access? So identification of these dormant plants that can be reactivated. A number of counties actually have taken up this, even going ahead to pipe this oxygen to the patient area where the patients need the oxygen. Because you remember I told you one other problem is how do you get the oxygen from where you've produced it to where the patient needs it.
As the struggle continues for those still hanging on like Brilliant, and while others grieve the death of their kin as a result of this crisis, all eyes remain on the Oxygen Task Force and the government at large and how fast they are able to turn the situation. Akisa Wandera, KTN News. Right, that there is a situation for a number of Kenyans, a story we continue to follow up on, already getting a lot of feedback here on the story of Brilliant. I'll just take a look at one or two. Gilbert Ocheng says, brilliant story there that has left me wondering what's the Kenyan government priorities? Politicians, so what do they gain by owning Kenya while Brilliant is suffering from lack of oxygen? I have another one here who says the oxygen story is no joke. And someone else here says, and I'll quickly take a look at that, stories like this should have come a bit earlier in the bulletin. Thank you for that feedback.